So basically, there are two type of inflammation: acute inflammation and chronic inflammation. So how it occurs when there is an acute inflammation and there is enlargement of gingiva, or when there is a chronic inflammation and gingival overgrowth is happening. So let's start. Bismillahirrahmanirrahim. So you can see there's an acute inflammatory enlargement has a complication which is known as gingival abscess. Gingival abscess may be a localized, painful, and rapidly expanding, but only limited to the margin gingiva or dental interdental papilla. Okay, in early stages, it is a red swelling with a smooth, shiny surface, basically, and it is also fluctuant and pointed. Okay, there's an exudate formation in 24 to 48 hours, means in 24 to 48 hours there's an exudate formation when you have acute inflammatory enlargement. Okay, very important. It is also sensitive on percussion. The lesion ruptures spontaneously, basically and when it ruptures, so it ruptures because of the acute inflammatory process. This gingival abscess consists of a diffuse inflammation of the polymorphonuclear lymphocytes, means it has a lymphocytes, edematous tissue, and vascularization. Okay, then surface epithelium has intracellular and extracellular edema, and it is also invaded by leukocytes, and ulceration is also present. The lesion is also only confined to gingiva, and it can be distinguished by the periodontal abscess. What happens in a chronic inflammatory gingival overgrowth, which is commonly associated with the biofilm? It was associated with the abscess, and this is now biofilm. Biofilm occurs when there is not proper oral hygiene, orthodontic appliance, poor faulty restorations, and misaligned teeth, oral habits in an open bite, or other factors basically that favors the plaque accumulation and retention also. Okay, then basically the patients who have gingivitis or gingival enlargement are often those patients who are mouth breathers. Okay, so the mouth breathers can also have the gingival enlargement. The gingiva appears in this case red edematous with a diffused surface shyness. It was more localized and it is diffused. Okay, very important. Now basically it is commonly seen in the maxillary interior region. Okay, and have clearly demarcated from the adjacent unexposed normal gingiva. Basically, the patient irritation is also from the dehydration that also contributes to the mouth breathing. Okay, so basically the mouth breathe when there is a dehydration, the patient one of the factor that leads to the mouth breathing, and the mouth breathing can also be seen in those patients who have gingival enlargement or gingivitis. Now you have a plasma cell gingivitis. Basically it is a manifest of a mild or marginal gingival enlargement that is extended to the attached gingiva. Okay, the gingiva in this case is red, friable, and sometimes granular, and bleeds easily. Okay, and one very important thing, always remember, in gingivitis the patient will not have the loss of attachment. Very important clinical point. If you see a bone loss in a patient, then it is definitely the patient of periodontitis. It is not the gingivitis patient. Okay, the lesion is located in the oral aspect, attached gingiva, or it can be also different from the plaque-induced gingivitis. Okay, you have seen that in acute and chronic forms of gingival enlargement that is associated also with gingivitis, inflammatory lesions can also be observed in other forms. Means the this gingival enlargement can also be gingivitis is basically associated with the chronic and acute forms, but inflammatory lesions can also be observed in other forms of gingival overgrowth. Okay, then they are saying that the systematic conditions also cause the inflammatory changes in gingiva. Okay, so and it can be a very distinction point that should be made very early in the treatment planning, and also to modify the drug systematic conditions and neoplastic lesions that can be carefully ruled out. Always remember, for treatment you should know the patient is using which drugs, systematic conditions, or any other neoplastic lesions. Okay.